I already spoke about procedures and the like TikTokification of procedures on TikTok, and how they're all becoming super dangerous, and how we already have veneer techs, and we have basement braces, and we have lip techs, and all sorts of things, right? And then I found another content creator who is also doing content about this, and her name is Isabella Lanta, and I found her after I made my last video, and then now she's kind of covered extra things that I want to talk to you guys about. So do check out her content. She posted a few videos about this stuff, but I'm just going to cover a few extra things, but do watch my old video because that's like the main stuff that I wanted to talk about, and then this is like extra stuff. So the first one we have is LED UV gel eyelashes, and there's one girl that does it. Her name is girlboss-ification. She has 50,000 followers, and she is in Atlanta, and she also kind of sells lash supplies.
The new UV technology.
Ooh, you feel it?
Ooh, yeah, that was hot.
Really?
And it literally burnt her, like literally burnt her. I mean, that's one way to go blind.
How did it feel?
It felt good.
And I can't imagine that pain, because I know, like, when I do my UV gel nails, sometimes you have like a weaker nail, or like something just feels a bit funky and it burns you, and it's this like weird zapping feeling that doesn't go away for a few seconds even after you take the light off, and it hurts, and I just can't imagine getting that on my eye. Just wow.
Okay, sit up. Something you got?
Oh, you guys?
Yeah. So
I
as
don't know why my eyes so weird.
no, but no, it could be the glue. Now I'm telling you, it could be the technology, because eyes don't never water. You never need the fan. With this type of glue, it looks like you still need the fan, you guys.
I got the fan on my eyes.
The fan is still on her eyes. She don't never use the fan. Never. Nate eyes is a little reddish.
So she never uses a fan, her eyes are red, but now she's having to use the fan, her eyes are red. I don't, like, the red flags are right there. They're staring you in the face. Then how you can like remove them. So UV lash removal. So you have the cream gel remover. I just wonder what's in that remover, and do they buy it on like Temu? Do they know what the ingredients actually are? But apparently it's as easy as that. Okay, so if that's what we want to believe, that's what we want to believe. This one actually talks about the fact that they use like a small lamp so it's safer. So they post this kind of sound. Unsafe UV system versus safe link gel method. It's like a tiny lamp. They don't tell the truth, but we do. Here's a controversial topic we'd like to address. UV LED systems are becoming the talk of Lashtown, and we're here to warn you to be aware of those goosenecks. UV lamps aren't telling you the truth. We are proud to say that we have the safest and only ANSI certified LED device on the market today. The Link Gel device peaks above 401 plus nanometers, meaning at the most powerful output, the light is on the visible spectrum, not in the UV spectrum, while those lamps peak in the UVA spectrum. And apparently, the other lamps were found at 290. That is almost 20 times more brighter than ours. Okay, so apparently there's a safe way of doing it. I just don't. Okay, and then 7 Lash posts girl math about how it's safe.
System safe? The answer is yes, and I'm going to tell you why. The actual lamp itself produces 6 times less power than if you were actually going to the nail salon to get your nails cured.
Okay, first of all, it's the comparison of like, well, it's 6 times less than the nail lamp. Okay, but how do you know that from the eye to the nail needs to be 6 times? Did you do that test yourself? Did you speak to a scientist that talked about the eye is 6 times more sensitive than the nails? Or is it 8 times? Or is it 10 times? Like, just throwing out numbers out there, oh, it's 6 times less powerful than the nail lamp. Okay, but how do you know that 6 times is what's necessary?
So if you actually do some girl math on it, let's say you do 100 lashes per eye, your exposure is basically 1 to 2 seconds per lash that you apply, which is 2 to 3 minutes of light exposure, which means less time on the field, which means you have more time outside.
Okay, then we have a seminar about this.
Gel lash adhesive safety has been a topic, a really controversial topic in the lash industry.
They talk about it at like a seminar, so I guess it's becoming like an actual prominent thing. I'm just so scared of people buying these lamps from who knows where, Amazon and AliExpress and Temu, and they don't actually know how this works. But then we have Lash Base Jamie, who's made a few TikToks about this.
Okay, a few things before I get started. This video is in no way meant to be calling out the person that's done this video. I've purposely tried to hide the names. I've done like this green screen video rather than any sort of stitch. This video is purely for educational purposes and to clear a few things up. Because as somebody that holds a position of authority in the professional lash industry, seeing things like that is the reason why the professional lash industry can have a bad name. And not only that, from looking through the comments of the video, people see that as pretty educational, when in fact it is very, very dangerous. That is not how you go about doing product testing. Now, I don't know what system she's testing or where she's got that from, and that's part one of the problem. There are many systems on the market right now that are super dangerous, and the type of light and wavelengths of light that are being used in these machines that are potentially unsafe can cause a lot of damage. So firstly, we don't know what machine that was, but the fact that when she first used it on the client and got it in the eye or around the eye, the client flinched, tells me that it's not the right kind of light. Because I've used them before, and if you're not using the right kind of light, you can feel the heat and you can feel it. And then when you see the process of it being used, it's being used by someone that hasn't actually had training in the system. They're just using it to give it a go. And that's another risk about what's going on with UV LED light and lashing at the moment. No one gets any proper training. You can just buy a system and use it. So then as you see the set progress with the time lapse, you can see the size of the light that's on the eye is covering the whole eye rather than just the bit that you're trying to cure the glue at. There's no protection on the eye to block from any of the light coming onto the lids. And quite often the glue ring that's containing the glue goes into the light as she's isolating, with the light on. Now when it comes to the end of the set, and the client's having watery red eyes, and then having to use a fan because they're stinging and watering and red, and then the lash tech goes on to say that it's because it could be the technology in the glue, and that normal glues that doesn't happen to, that is incorrect as well. Now again, most systems at the moment that use this UV LED curing still have cyanoacrylate based adhesives. So in a way, it's kind of the same as normal lash glue anyway. And the reasons that you can get red eyes and watery eyes and stinging eyes and all of that is quite often caused because the client's eye is very slightly open so the vapours from the glue can go in. Now this can be because the client's talking too much so it's making their eye move, or it can be during isolation when you're leaning and pushing onto the eyelid, it can open it up. There are other reasons like the iPad rising too high, but most of the time it's just because there's some fumes and things that have gone into the eye. So because this is probably what's happened, that means the eye was actually a little bit open, meaning this UV light was going into an open eye, which probably added to the...
And then he posted a second video about this that got a little bit less buzz, but still there.
My mouth about UV LED lash extensions, it always somehow turns controversial. And the thing is, look, I get it, it's a hot topic at the moment, you're either pushing for it, which always causes arguments in the comments. And most of the time people are uneducated in the system, so then they comment with things that aren't actually true, which then just stoke up even more controversy. But here are my thoughts as of right now, because I've been updating this every 6 months or so as I learn more. The first thing I want to ask is, why do you think you want it? Most of the time, people are looking for this new product. It doesn't have to be UV LED lashes. It could be absolutely any product, but they're looking for a product to solve their problems. And the truth is, whether it's a glue, whether it's the light you're using, whether it's...
Basically, he goes on to say that some people think that they'll have better retention, like the lashes will last longer with this product, or they'll do their job faster. But he says it's not a product issue, it's a technique issue. And unless you fix your technique and iron that down, you're not going to get any better results just because you use a stronger product or a product that cures faster, essentially, is what he's saying.
retention using UV LED lashes or just the normal lashing way.
And that's obviously, like I said, about the retention, just further elaborating on the fact that it's not going to fix your technique, it's not going to make you make more money because you're doing them faster or anything like that. It's just a new way of doing it, but it's not any easier or faster or anything like that. Now he also does comment on, there are two different types of lash techs. There are some that focus on lash health and doing things in a new way and doing things to help your lashes not fall out. And then there are more like traditional old school, it's not that deep, it's just lashes kind of people. And those are the people that will just buy a lamp off Temu, off AliExpress, and just be like, oh well, it's just lashes, like who cares at the end of the day. Whereas some people are like, this is just unhealthy and it's bad. And I think the same thing happens with lip filler. There are some people that are like, let's focus on proportions, doing things the right size and having things done safely. And then there are people who are just like, oh, you want me to fill your lips in for the 4th consecutive month? Yeah, sure. You want to look like a duck? Yeah, who cares? It's just lips, you know? And then I guess there are different standards for different people.
I promise you there is not a type 3 when it comes to lash artists. And if you don't know what I'm talking about, let me just briefly explain. I believe that there are only 2 types of lash artist. And the short versions are type 1, those that care about lash health, lash styling, lash science, all of that stuff. And type 2 lash artists would call them boring and old school. And type 2 lash artists are those that enjoy just having fun. They don't like the rules. They don't follow along with what's going on in the lash industry. They think people that care about lash health, lash length, lash styling and all that stuff are boring. And they also think it's not that deep. It's lash extensions at the end of the day.
So as long as like you look good, that's it, right? I'm worried about this because I actually think people are not sourcing the LED lamps from anywhere fantastic. Like I think they don't actually know how to do things. They're using these massive lamps. Those lamps, the ones that are kind of like the gooseneck, and they're like that big one, they're actually used for Gel X. Well, that same size is usually used for Gel X. Now I'm worried that people are actually selling these Gel X lamps and then just renaming them to be eyelash lamps and just faking it, honestly, because there won't be any repercussions for these companies. They'll just shut down a company and open a new one. But I'm worried that they're literally just reselling lamps that they used for Gel X because Gel X was blowing up on TikTok for a bit. Yeah, these lamps, because you have to hold the nail down and then kind of hold it under the lamp like this just to cure it quickly, and then you put it under the lamp. So I'm just worried that that's what they're doing, and then they're just renaming them and selling them now as eyelash glue lamps, but they're probably the same strength. So that's what I'm worried about, because they look identical and they're way too big for the eye. And there's obviously that small one that you can use. And there are seminars happening right now and there are people being educated in this. But I think just like with everything else, there'll be people that do it properly, but they'll be in the minority, and then there'll be the people that burn people's eyes and potentially make them go blind. That's shutting the chapter on LED gel lashes. Let me know what you guys think about that. Now we have teeth acrylics. This is a short one. I just saw this on Twitter and I thought I'd bring it up for you guys. People are doing teeth acrylics.
I do this for real. And side note, I do this for a living and for fun.
Not
So when you ask me,
just acrylic and gel in your mouth. In your mouth. Obviously it has to like dry and cure before it. Like if we taste it. Oh my
what
god.
I do for fun, this. And I ain't practicing.
I mean, those don't look good anyway. So it's just a bit like cool. So that also got 5 million views. It kind of blew up on Twitter. But so we had the veneer techs and we had the veneers kind of at home. We have basement braces and now we have acrylic teeth. Is it ever that deep? Do you ever need straight teeth that much? Because no one does. I promise you that much. No one does. Then we have some lip injector updates. And so then we have Ryan on TikTok, who is a lip injector, and she does things a little bit more ethically, I guess. She is now exposing So Mink and the kind of lip tech industry because they're just not doing things right, and she's having to fix their mistakes, correct their mistakes, and she's seeing a bunch of infections. But yeah, the person that she's talking about is So Mink, and So Mink has actually kind of tried to make it look like she doesn't do filler anymore. So I'm going to get into that in a minute, but she posted this TikTok originally.
I really need you guys to help me with this video. I've been trying to post this video in so many different formats, but TikTok won't let it stay up. I don't think I've ever been this in my career in the 3 years that I've had my business before. Like, today has been definitely one of the most difficult days, and it's all because of another person's malpractice. And I can't even use the word malpractice because that implies that the person should be practicing in the first place. This person should not be practicing. She shouldn't be touching anybody's face, but here we are. So about 3 days ago, this girl reached out to me saying she had gone to Houston to see somebody to get her lips filled, yada, yada, yada. She came back. Her lips started to swell up a little bit. She reached out to the person. The person told her this is perfectly normal, which in fact it is. It is perfectly normal. It's going to go down after some time, but she said her lips progressively kept getting bigger and bigger. So she reached out to me on TikTok. I told her to go ahead and book a consultation and we can do it virtually. She doesn't have to come into the spa. So she booked a consultation. We did the virtual consultation. I saw her face and immediately I was like concerned, right? So I was like, how soon can you come in? Come in as soon as you can. Now, of course, I asked her, do you have any allergies, anything like that? Have you ever gotten lip filler before? She said yes, and this never happened, but it had been 3 years since she last got lip filler, and then she went and got it this time in Houston. So she comes into the spa today, and her lips are way worse than they were when we were on the virtual call yesterday. Like, somehow they are 3 times worse than they were yesterday. And I'm looking at her like, girl, I shouldn't be touching your lips. I feel like you need to go to the hospital. And she's like, she doesn't want to go to the hospital. She doesn't have insurance. Like, it hurts. She just feels like she needs to get it dissolved. I'm like, the fact that it is continuing to swell up means that the lip filler is definitely somewhere that it shouldn't be. And so you need to go to the hospital. Prior to Prior to heading to work this morning, I made a video about all of these illegal injectors that are out here. I was actually referring to this particular girl who is in Houston, who is a lash tech in Houston, who decided at some point last year to start doing lip filler. This is her client. And the reason why she stuck to my mind is because this is the third person I have seen in the last 10 months who has seen this girl. No one has been as severe as the client that I saw today, but 3 people have seen this girl and have come to me, and we've had to get their lips dissolved.
Sorry guys, I was looking off to the side and blinking because my contacts have dried up a little. I think I just forgot to blink for a minute. But yes, so obviously she had 3 clients from SoMink come with what seemed to be infections at this point.
With the first client, we were unable to get her lips to be dissolved, which means whatever was injected in her lips was not hyaluronic acid. That is why the hyaluronidase, the enzyme that is supposed to dissolve the lip filler, was not able to work. So she had to end up going to the hospital. I tried to follow up with her. She never followed through with me, so I don't really know what happened in that first case. In the second case, her lips did get dissolved. However, I wasn't really...
That's almost even more concerning, that it's not even consistently good or bad, right? It's it'd be one thing if SoMink just wasn't filling with filler at all, period. Because then you're like, okay, just every single time it's bad. But the fact that sometimes it is hyaluronic acid and sometimes it isn't, I'm like, oh, she just doesn't care where she gets her filler from. That's the real, she just, oh, they have a sale going on right now, let me grab it from there. And they have, you know what I mean? It's just never consistent. Because I feel like if you're an actual ethical, you do things by the book, once you find a good vendor and you find someone who is, you order from the company itself, and you know what I mean? You know where it's coming from every single time, and every single time it's going to be hyaluronic acid. Whereas she's just just wherever, wherever it comes from, I don't care.
Quite paying attention to the name that they were saying, because they both said the same thing, mink or minky or SoMink. But they kept using the words injectors. She is an injector. She is a black injector based in Houston. So in my mind, she is an injector. I'm not thinking it's somebody, some girl, But yesterday when I was on the Zoom call with this third client, I was like, who did this to you? Who is the person? And she actually said the name again. And I'm like, why does that name sound familiar? And then she sends me this girl's page. And that's when I find out the reason why all these people have been having these problems is because this person is not an injector. This person is a lash tech who is getting supplies off of Amazon.
And you can imagine, obviously, her name on Instagram and everything is SoMink because she started out doing mink lashes, and so she just didn't change her name, didn't change her branding, because you kind of want to keep some branding so your clients can find you. But yeah, so she started out as a SoMink lasher.
Affecting people's faces. Now, I have tried to post a video showing her pages. I did the green screen thing, and TikTok said it was violating community guidelines. And I'm like, dude, I'm trying to tell people to stay away from this girl. In one of her posts, and I'm going to attach the image here, she actually says, as a response to someone who asked the question, how can you do this legally in your state? She says, you don't need any license to do this in the state of Texas. That is categorically false. That is actually so untrue. It is mind-numbing. Anyways, today was the very first time in the 3 years that I have owned and operated Maiza Medical and Wellness Spa that I've had to call for emergency.
She also posts this video.
This video is for educational purposes only. I tried to find an image that looks like what my patient looks like yesterday. As you can see, this girl's lip got very swollen, and there's because one side of her face is swollen as well, and she had to go to the hospital. This is an unrepentant criminal. This lash tech in Houston has decided to start doing lip injections, and she led to my patient's struggles yesterday. My patient is still at the hospital today. This lash tech is also taking time out of her day to teach other people how to do these illegal injections so we can have more of the cases that I just showed you in the very first picture. As you can see here, she teaches how to use the hyaluron pen to administer filler into people's lips. Her classes start at $995. This unrepentant sociopath sent somebody to the ER.
I did find her website. It still says SoMink, the branding is the same. And now the only things you can buy are lip plumpers, which are lip glosses that look like injection vials. View all, there's nothing, literally just that. The Iconic Lip Extreme Plump, which used to sell actual products to fill lips with, so you can start doing it yourself. Vendors accessories, mink hair protection, And then cosmetic brand beginner's e-guide. She used to sell guides on how to fill lips, how to brand yourself as a lip filler. Obviously deleted all of that. FAQs, shipping policy, refund policy, damages issues, blah blah blah. Like, it doesn't, you know what I mean? Like, you can't even, you used to even be able to book, I remember when I was still planning this video, you could still book like a course with her. Now even that's not on here anymore. She just literally has the contact page, FAQ, and that's it. So yeah, she's just selling one lip plumper. She did have a beauty Instagram page at first, which was the So Mink Beauty, and that links back to the website. And we know it's her because we can see that it's her because she's following herself on that page. And she also has a mink vendor Instagram page, ready to become your own boss, make over 6 figures a year, instant download, and she'll basically do like mink hair vendor and how many sales she made. And that one also links back to her. She follows herself and So Mink Beauty. I have to sadly go now, but I'll finish filming when I get back. So I stopped filming yesterday because I had to leave the house, but I'm back just looking a little bit different, and I just wanted to continue talking about the things that I was talking about. So then Isabella Lanta was actually sent a cease and desist because of her OG lip filler bandit video, which is a great watch, I'd highly recommend. But she reads the cease and desist and it's just like BS. Turns out that the person sending her that cease and desist found the lawyer on Fiverr, and they'll do this thing where they'll like send a cease and desist just to scare someone away from speaking about you, but they'll never really pursue legal action. It's just more of a scare tactic. So I'm not going to go over all of that because obviously it's just a lot of Isabella talking about the whole thing, reading the cease and desist, so you can go watch that. It's in the first part of her video. We also have some more TikToks, allegedly.
Now I am going to show very quickly a few other clips here that she made, again in the now deleted TikTok, where she was talking about how people were claiming that what she was doing with the hyaluron pen is wrong. I want to state that she was trying to support her claim by saying that the FDA doesn't approve of tattoo ink, whatever. Just listen to the shit.
I have been getting that I am supposedly getting my filler from Amazon, Tumi, and AliExpress. I have multiple bank statements and multiple wire transfer that my filler is coming from South Korea. And I will also put the proof here that I spent over $30,000 in the month of February on filler and supplies. And that what I'm doing is illegal. I am running a criminal business, enterprise, whatever. The hyaluronic pen is not illegal. And it's not FDA approved, but it's not banned. Tattoo ink, baby formula, and some makeup products is also not FDA approved. And here's also proof that a doctor is trying to make it illegal. The main reason why people don't like people using the hyaluronic pen is because anybody can use it. You don't need a doctor or nurse license to do the hyaluronic pen. They want you to go to them and get their lip filler done. We are taking their business. That's why it's so much backlash about us doing the hyaluronic pen. Much respect to all the doctors and nurses. Personally, I have trained 3 nurses. I have a doctor that comes to me to buy filler, and I will also put the proof there.
The fact that she literally went on to say that nurses...
That's obviously So Mink talking about kind of how her business is fine. There are many products that aren't FDA approved. There are nurses going to her for training, blah, blah. Like, those nurses shouldn't probably be nurses if they're coming to you for training. But this is all before So Mink shut down the whole lip injector business. So clearly she was super, super confident that her business was fine and dandy, and was clearly very quickly told otherwise. Because now when you go on the website, like I showed you guys, nothing there other than some lip like plumper gloss, and the page isn't on Instagram anymore. She only has her like makeup page and her vendor page, and that's all she has. So I wasn't able to obviously find this TikTok anywhere because it has been deleted, so shout out to Isabella for getting it.
Go into your classes where you will teach people about the hyaluron pens. You're going on a hyaluron tour. You got a damn billboard in New York. Insane to say the least that you're doing that. Also, laws vary from state to state, so I'm amazed that you're comfortable doing that. I don't feel like it's right in my opinion. You also do microneedling one-on-ones or microneedling classes. Who are you to be doing a microneedling class with an actual needle to people? Who are you? If you don't have credentials, as I've stated, that's not right. Additionally, this is just to show the date, May 21st, to see that this is very current information on her website to show classes and trainings.
Yeah, see, that's what she doesn't have on the page anymore. She had it when I was planning this video, and now like none of that's on the website anymore.
has microneedling training. Now, this is insane because it says this training is for certified hyaluron pen techs. First of all, what the
I agree.
Oh, and by the way, if you do not think Texas is not honing in on some of y'all, I would be a little bit concerned, because let's refer to this article right here talking about a cosmetic clinician giving alleged side effects. This is posted Thursday, April 18th, 2024. Mr. Injector 1 client claims alleged unlicensed cosmetic clinician gave her 1 million side effects. Instead of giving her an FDA-approved filler, she says he injected her with a silicone-like substance which caused pain, inflammation, hard nodules, and bruising.
Isn't that kind of what happened with Soming and Ryan, who had to then dissolve it but realized it wasn't dissolving and therefore it wasn't hyaluronic acid? So obviously similar issues. So I get why Soming has very promptly cleared her website and cleared that Instagram page and that TikTok account. I get it. So that's that from Isabella. Then we have, and this, I believe I got this from Isabella. She found this person called Lashes by La Gorgeous. And so she used to be called Lashes by La Gorgeous. But now I think she's called Aesthetics by La Gorgeous. Yes, on TikTok she changed her name now to Aesthetics by La Gorgeous, but you can still see some people have tagged her as Lashes, and obviously that's not. So this is another person that's gone from the lashing business straight into the filler business. And people are saying things like she is using gloves, but then she's touching everything with the gloves. And it's like the issue of when people go to McDonald's and they say, why isn't everyone wearing gloves? Because they think gloves automatically means no bacteria, but what it actually means is you're more likely to touch things because you're wearing gloves and because you think it's clean, so you're more likely to put the gloves on and then touch stuff. Whereas if you're just using your bare hands, you wash your hands a lot more often. And so in very high-end restaurants, they never use gloves. They'll always just wash in between all the steps and then not touch anything to cross-contaminate. But you can see she's just using pink gloves. This pinkification of cosmetic procedures as well, the girlboss-ification, the pinkification, everything is pink. The injections are pink, the gloves are pink, the face masks are pink, like everything is pink. And just because something is pink doesn't make it good. Yeah, so this is her. She's a Houston aesthetics injector, and her Instagram is still Lashed by La Gorgeous. There's this TikTok, I guess, of like ridiculous lips. Those are, like from up above, they're already migrated and they're just about done. Like they were just done. And this is not a thing of if your lips are naturally that big that there's something wrong with you. It is the way that they've been filled to look like they are migrated when they haven't even had the time to migrate. Like they're just migrated from the get-go. So I found that, which was ridiculous. I guess I thought there was something ridiculous with this one. Oh yeah, so you can see when she puckers her lips as well, just how far up they have been moved essentially, which is not good, but they are $300, I guess. DM me now, sale ends. Then we have hyaluron pens, which is what all these people will use. It's basically a needleless method of injecting lips, but it's actually no safer than just using needles. So you should go to someone who's a nurse or has studied under a nurse, whatever the licensing is under in your state or in your country, but someone who has experience with medicine and needles, and you should go to someone who does needles, because at the end of the day that is the best way to deposit hyaluronic acid into your lips. These hyaluron pens are not it. This micro needling, not it. You just need to do it properly. It's like, you know when they say get it cheap, get it twice? That's kind of the vibe we're getting here. So here's why someone said hyaluron pens are not good. So she reacts to someone's hyaluron pen disaster, and she said this is the most dangerous way to get your lips done. Oh, you can see how she flinches at that because it like shoots it into your lip.
This right here and what I just viewed getting done in that video is the most dangerous way to get your lips done. If you guys are new here, my name is Alina. I'm an aesthetic injector out in Arlington, Virginia, and I love giving my patients natural looking results. Those of you who don't know, this contraption is called a hyaluron pen. The people that are offering these treatments are not licensed medical providers. The device works by shooting some sort of hyaluronic acid mixture via pressurized air into the lips, and it's appealing to consumers.
There's also this thing where like, I love from the get-go her saying I love giving people natural enhancements rather than changing the way their face looks. The idea is what you were born with is more likely the closest to what looks best on you, right? So like your hair color, chances are the closer you get to your natural hair color, the more that fits you, because that's how you were born. Your natural eyebrow shape is typically the shape that your eyebrows kind of should be, and obviously there are no rules, you can do whatever you want, but people tend to say like if you want the most flattering results, it's usually what's closest to what you have naturally. Like, I haven't really touched my eyebrows in ages. I know there was a trend of like putting them up, and then there was like more of an arch. I just think this is what works for my face clearly, because that's how it is on my face. And that's not obviously the case for everything. There are going to be anomalies, but typically that's what it is. So when you get lip filler, it should be an enhancement, but it shouldn't be just like you have my lips and then suddenly you have the lips that I just showed you guys from Aesthetics by La Gorgeous. Like, there's no way that would look good on me. And if I wanted lip filler just to boost the hydration levels and make my lips look a little bit more plump, they should still remain within my lip shape and within my kind of face frame, right? So I'm always happy to hear someone say, I love giving natural enhancements. Then I almost feel like I can like trust you a little bit more. I also always wonder when I see these hyaluron pen fillers, it's like, how do you know where to aim? The whole point of the needle is it's a pinpoint, precise location that they can add the hyaluronic acid as they see fit, like where it needs it precisely. I've gotten lip filler done once and I've never done it again because I just didn't think it suited my face, but it's precise. Like, if you wanted a little bit here, that's exactly where it was going, okay? So with these pens, they're literally like holding up from the top of their fingers, or with that metal thing, which you shouldn't even have to use that if you're using a needle method and you're good. You shouldn't have to be using something to like almost contain the shape. But because they're containing the shape, because then they're like shooting it up into just an area of the lip, there's no way that this can be precise. Hence why all of these lips look disastrous, like truly. And I'm so sorry that I'm saying that about someone's face, because obviously that's what they have done to their face, and if they love it, amazing, but it is not a look that is, I'm gonna just try and end that there just so I don't get disrespectful.
Because it's marketed as painless and needleless. The reason why this treatment is so dangerous is because when these people are shooting this stuff into your lips, they have no control over where this hyaluronic acid mixture is landing. It can potentially land into an artery, cut off blood flow to that tissue, and cause necrosis, aka tissue death. Since the people offering these treatments are not licensed medical providers, they definitely don't have access to dissolvers. So if a complication were to occur, they can't reverse the issue. If you want fuller lips, please save up your money. Go to a licensed medical provider that knows what they're doing so you can stay as safe as possible.
And then there's also the thing of, well, clearly this is happening. Clearly they don't have dissolver on hand because they're not allowed to use it. And then you have people like So Mink that I literally just spoke about, where like 3 or 4 clients are having to go to someone else to dissolve their lips. They're having probably infections or some kind of a reaction, probably because of this. So Mink can't dissolve it. And then Ryan can't dissolve it because some of it is not even hyaluronic acid. So it's like, not only are you just like shooting this mixture just randomly wherever in your lips, your body's having a reaction to that, it's also something that's just not hyaluronic acid. So then it's just this whole concoction of issues. So then we have this TikTok about hyaluron pens.
The hyaluron pen works by creating enough pressure to the tissue to push hyaluron into the skin.
Please do not do this. Do not use a hyaluron pen.
I'm sorry, the things I felt when she was like into the lip, there was, you couldn't pay me to have that happen to me, because like getting lip filler itself was quite uncomfortable, even with numbing. Like, you can just feel it a little bit, like it's just not the most comfortable, but at least it's done properly, and there is a level of care, because you obviously just put the needle in and then you slowly, pull out, and there's a level of care there. That,
do not go to somebody with a hyaluron pen. Just don't do it. Naturally plump and cute lips are totally in right now, but don't cut corners. With using a device like this, you are just asking for lumpy, bumpy lips and possibly an occlusion, which is when tiny fragments of filler can get lodged into an artery, obstructing blood flow. It's important to come to an injector that's going to do a thorough analysis on your lips, on your goals, and pick a filler that is going to get you to where you want to be.
and this is someone called the needle nurse. That's what I love to see. First of all, needle. Second of all, nurse. Needle, nurse. Perfect. That's what I like to see. While I was playing this video, I randomly came across Dr. Mike's video that I added to my watch later. It was about med spas. And then I watched it and I realized it was actually kind of to do with this. So the original video is here. You guys can watch it. I'm only going to summarize it because it's very, very long. But this is her GoFundMe. She's actually fighting like against this med spa and trying to pursue legal action. But no one's really picking it up because there aren't specific laws around it. And this is her TikTok account where she kind of shows her life, how it is, vlogging her journey, skin, body positivity, transformation. And then she also is showing the like legal proceedings and how that's going for her. So she obviously talks to Dr. Mike about this whole thing. So she was contacted by an IG like med spa because she posted some fitness content. All she had to do was vlog it, but then she still ended up paying $800 for it. But then anyone that used her code for this med spa would then give her credits for like future procedures that she would want done with them. So then she developed an infection that she's dealing with to this day. It landed her in hospital. She was there for weeks, if not months, and she's dealing with that to this day. You guys can watch her playlist about it. There's 33 posts. I can show you a few of it.
I'm 25 years old and over $1 million deep in medical bills, and this is what a day in the life looks like for someone who's on treatment 6 hours a day. Most days I feel like shit, but after a year and a half of being on treatment, I've gotten pretty used to fighting through it. I have a great work from home job that's super understanding, and as you can see, I'm pretty used to being hooked up all day. It turns out anything can be an IV pole. And yes, showering is a pain, but I had to get it done before seeing my nurse. By the time 8 p.m. hits, I'm right back at it, hooking myself up for the next 3 hours. I would be lying if I said TikTok didn't help me get through it. I pretty much scroll up until bedtime.
People ask me what happened.
Hi, I'm Bia, and I know a lot of you are new here, so I wanted to reintroduce myself. For almost the past 3 years, I have been fighting a flesh-eating skin disease called Mycobacterium abscessus. And for about 2 years in total, I had to run IV antibiotics 6 hours a day through the port in my chest. Again, all of this happened because of one stupid mistake. I went to a med spa that said they were licensed and insured. They lied. I went for B12 shots, and I left fighting for my life. I spent months in the hospital, and here I am today trying to advocate for myself, show body positivity despite the fact that I have hundreds of scars all over my body, and to also fight for justice and be a reason why the laws one day change. Many don't know this, but med spas are seriously unregulated. It is basically the wild, wild west out there, and despite what happened to me, I have tried my absolute best to remain a positive person and chase after my dreams anyways. Because of my skin condition, I've been told many times to give up on my content creator and influencer dreams, and instead, I am making the best lemonade out of the shittiest lemons. I really just wanted to say thank you for coming to my page if you're new here. I really appreciate the follow and the support, and I will continue to vlog my journey.
So that's obviously the story, best coming from her rather than me. But this is Bia. Obviously she's dealing with this, like I said, because she went to a med spa, wanted some B12 shots because apparently they were supposed to be like amazing, the bee's knees. She went to this med spa and they just basically like, they can just shut down and move on to the next location and they'll just reopen under a different name. But yeah, she was in hospital for 3 months on IV and antibiotics and wound care because she was covered in like, you know, the skin kind of condition. She's also lost some of her hearing and has tinnitus now. No one had a medical license, and talked about kind of what's happening now with at-home lip filler or lip filler from these med spas or just anything like that. So she does kind of touch on the subject that we're already talking about, and what she was injected with was actually bought from Alibaba. And then there's some recent updates I saw on her TikTok about legal action.
With me while I update you on my life. First, good news I have for you guys is that I found a surgeon. I have been searching for a good surgeon since February. More shockingly, and I guess maybe this is just the power of prayer, but my granulomas have stopped hurting and stopped growing. In January of this year, I was still on treatment, and while I was on treatment, it was almost excruciating how quickly and aggressively they were growing. As you guys can obviously see, I don't have a port in my chest anymore, and I'm not hooked up to the meds all day. And so now that I'm not, it's been a little bit of an adjustment getting away from those like sad and depressive habits. But that's besides the point. The point is that I finally found a surgeon who feels really confident and comfortable operating on Mycobacterium abscessus. A friend of the surgeon's was actually operating on someone who had Mycobacterium, and then they accidentally poked their forearm with the scalpel that they were operating with on a patient that had Mycobacterium. Now, unfortunately, because of that one needle poke in his arm, the Mycobacterium was able to harvest and create the infection in his forearm. He had to undergo the same antibiotic treatment regimen, port in his chest and everything to try and eradicate the bacteria and future growth of the bacteria in his arm, as well as have several surgeries. And unfortunately, he lost so much mobility and had so many tendons damaged within his forearm that he actually had to stop plastic surgery. So when people ask me like, oh my gosh, why is it so hard to find a surgeon? Go to the Mayo Clinic, go here, go there. Of course, I've checked with all these places. Even the last surgeon that I had a consult with, he wasn't comfortable doing surgery on a patient with Mycobacterium simply just because it's so unknown and the risks are so high. And so all this to say, it's such great news that I found a surgeon that feels comfortable and confident operating on someone who has an active Mycobacterium infection. However, what really sucks is that my insurance does not want to cover this doctor. And so now I have no idea what to do. And his plan is exactly aligned with what I feel comfortable doing for treatment going forward.
So obviously you can tell how difficult this has been for her, but then there's also this.
Finally found a plastic surgeon that is willing to take my case. However, my insurance is not going to cover him, so I actually have to call and switch insurances. In the same day, I also had my flight to Los Angeles because I had court against the horrible people that ruined my life. People oftentimes just assume that because I'm in a lawsuit, I'm going to be able to collect on something, but unfortunately, in my case, that's not the case because they have no money. I feel so out of it. Like, I don't, have...
So yeah, she is pursuing legal action, but it is obviously difficult. One, a lot of lawyers don't want to take it because it's not worth it. They don't have money. There isn't much kind of legislation around this, and chances are she won't get anything from this, and she's already millions in debt essentially from medical procedures. So that's that. I felt like that was really interesting to have an actual doctor do an interview with someone who's obviously going through a similar thing that we're talking about, where you could be the next victim of one of these lip filler, basement braces, veneered tech people. But then Isabella posted a video literally right before I filmed this, and there are now people doing fat dissolving. So the people that are doing kind of lip fillers are now also doing fat dissolving. So there's Luscious Beauty by Chantal, only has 1,000 followers on TikTok, luckily. Basically she shows how much you can make if you have 3 clients per day, and then she showed herself dissolving someone's filler with the hyaluron pen. So not only are people using the hyaluron pen to fill people's lips, they're now using that to dissolve people's lips, which is even less you really need to be precise there. She's selling all the equipment too, and the courses, the typical stuff, but she also uses the pen for dissolving fat on the body. And you can go on her schedule, because I actually went to look up her schedule. She has under appointments, obviously drink a lot, blah, 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 blah. But then you can choose a category: academy for courses, fat dissolving, and lip filler. So if you click on fat dissolving, you can do a small area, large area, or 3-session fat dissolving small area. It's designed to break down fat in unwanted areas, and she uses the hyaluron pen for that. I am sick. I'm sick. Please don't ever do this. And then we have Addicted Lips, who's doing the same thing on Instagram. They're doing micro needling kind of lip filler. They sell the supplies wholesale, and they also do the fat dissolving. And I am, once again, sick. Once again, I don't want to shame someone's lips, but they all just look the same. It's just how much can you put in as much as possible. They're already a little bit migrated, literally as they're leaving. And I understand that you can have swelling and stuff, but these are, the before were amazing. But yeah, she also does fat dissolving. But yeah, so that's basically everything. I hope I don't have to speak about this again, but I probably will. So let me know what you guys think. Have you seen anything recently that you want me to talk about in regards to this or anything else? Subscribe to the bell icon for engagement. I'll see you guys in my next one. Bye guys.